My father, like many African American men, was diagnosed with prostate cancer at an early age. The Center for Multicultural Health convened a group of African American men at Langston Hughes Performing Arts Center in Seattle for further discussion about the disproportionate rates of prostate cancer in the African American community. Over the next 30 minutes, these brothers will talk about their experiences with prostate cancer screening and, in some cases, as prostate cancer survivors. These men are not medical experts, and therefore the information provided in this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. You should always seek the advice of a qualified healthcare professional regarding prostate health.
You know, prostate cancer doesn't have any face. It doesn't care who you are. And if you just want to look at some of the tough brothers who've had it and athletes as well. Ken Griffey Sr. was diagnosed with prostate cancer a few years ago. Colin Powell, Harry Belafonte, Desmond Tutu, Nelson Mandela, and I'm sure there are others that we don't know about. So it doesn't matter who you are. It doesn't matter how powerful you are. It doesn't matter what kind of athlete you are. It will strike anybody at any time. Well, the prostate is a small gland, about 3 centimeters, that sits between the bladder and the rectum. It's a hollow-shaped, walnut-looking organ. And the role of the prostate really is to produce sperm by producing seminal fluid in sperm, which causes semen, and so that's the role of the prostate. There is a correlation that men who have a history of prostate cancer in their family are more susceptible to acquiring prostate cancer. So obviously everyone should go, but those men definitely should be going to the physician to have an exam done.
I'm a prostate cancer survivor. I'm in my 9th year of survival. And I started taking PSA tests because my dad died of prostate cancer.
We actually have a history of prostate cancer in our family. My cousin last year called me and told me that he had prostate cancer.
My family, my grandfather died with prostate cancer. Not from prostate cancer.
My father had prostate cancer, and he passed away at 72, and I think that was very young. However, for that reason, my brother and myself, we always constantly, once a year, we make sure we go in and you know, let the doctor do what he has to do. And like you say, I'm one of those fans of Morgan Freeman when he said, you get busy living or get busy dying. So I chose to get busy living.
There are some things that can help in terms of trying to curtail prostate cancer, such as, you know, diet, exercise, and just eating right. It makes a huge difference.
There are studies that show that if you have a diet that includes a lot of tomatoes, or I can't remember exactly what it comes from, the byproduct of the nutrient out of tomatoes, that helps prevent against prostate cancer. There's all kinds of other antioxidants that you can eat, broccoli, laying off the alcohol, and those kinds of just commonsensical things that you can do to not only help with prostate cancer, but many other forms of, you know, disease and sickness.
Start eating right. Start keeping your weight down. Start eating salads, apples, drinking protein. A lot of protein, whey protein. Start thinking about your life. I know, I've been there. At 35, I didn't think of nothing but girls and fast cars. If I could do anything different, I'd include my diet with that. Because when you get 50 years old, things that you did at 35 catches you at 50.
And prostate cancer is one of those things that I didn't walk around one day and said, man, I feel like I got prostate cancer. Right. Something's just not, there's no symptoms. I mean, there was nothing. I've got a friend that I work with that just found out he had colon cancer, and kind of what you had just mentioned, he went to the doctor because his shoulder was hurt. And they asked him how old he was, and they did the test and found out, wow, you've actually got something a little more serious than a shoulder injury. Yeah. So the best feeling I can have most of the time is when I've talked to younger friends of mine, fraternity brothers or whatever, they said, since you told me what happened to you, I went and got my prostate checked. I got a PSA, and I'm okay.
And the first thing your physician's going to do is, if you're over 40, and he or she will do what's called a DRE, digital rectal exam. And essentially what that is your physician will take a lubricated rubber glove and will insert his or her finger in your rectum. And the reason they do that is they're checking to see if the prostate has enlarged. They're checking to feel the surface of it. And that will give them an indication if perhaps maybe there's something going on with the prostate. If then they feel as though that you have an enlarged prostate and the feeling of the prostate itself is something that worries them, then they will order something called a PSA, which is a prostate-specific antigen test. And what that is that it's an enzyme that's in the blood will determine what your level of PSA is, which is produced by the prostate. And once your levels come back, then depending upon what they are, normal levels are anywhere from 0 to 4, and once you get over 4 for men, usually over 50, over 4 is a level when your doctor usually becomes concerned, and then for men over 60, usually a PSA over 7. But PSAs vary.